Good morning, everybody. I'm Rob Wallace. I'm the STEM education specialist at the World War II Museum, and I manage a lot of our teacher and curriculum programs, including real world science. And we're going to start today with the expert on that time period when the 1918 flu pandemic occurred. It did not originate in Spain, and so I don't want to call it the Spanish flu. Let's go right now to Laura. Laura Vogt is the curator of education from the National World War I Museum in Kansas City.
Rob, thank you so much. It's really nice to be here, and I'm going to wait just a second to see that my slides are able to come onto the screen. So this is Camp Funston, right? Kansas, it is known for being flat. This is Thanksgiving Day in Camp Funston, Kansas. And so when we talk about the fact that this was a centering space for this disease, and it is from kind of this spot that it spreads out around the world, having been a nation that is quarantined for the last 2 months, this may be giving some of you the heebie-jeebies, seeing that many people all squished together in one space. But it doesn't stop there, right? You've got folks who are heading off
in Antarctica.
More, again, this is what these ships are looking like. These are the folks who are returning back from overseas. This is Americans who are shipped off to Vladivostok, Russia. More and a different portion of Russia. I mean, we are covering so many continents. Again, you've got Americans who are serving in China. They're actually helping with a different pandemic, the cholera pandemic at the time. There was an unexpected turn. Science wasn't up to what the experience was for those who were living through this moment. And you can see a bit from one of our letters. We expected to be quarantined upon our arrival, but we're not. We had 33 deaths aboard. 3 more died on the way to the hospital, and 5 died the night they arrived at the hospital. All were troops. That's a reference to all were soldiers, with the exception of 1 sailor. The Spanish influenza certainly caused some casualty list. It was unexpected, and proper arrangements had not been made to take care of the men, something that will not happen again. This is just one of a series of letters. This is also an uncensored letter. You can see more about this and this particular gentleman. You can see the artifact number down there at the bottom if you go to our website. And he talks more about that experience of being in the US military as this is really exploding across the world. And it certainly causes a lot of casualties, particularly within the US troops and servicemen. Now, they didn't know what was necessarily causing it. Out of a first call, the camp newspaper of the 354th, right, we look a little bit further on to say that there sure seems to be no method of preventing influenza, but there is no doubt that overcrowding in stuffy billets and promiscuous coughing and sneezes are 2 of the most important causes. So they were able to track some of the things that we know as well, and some of the things that we've been trying to do in the present day. Add more space, cover your mouth, and the like. Now, again, as I said, it was already, and as actually it was Rob said, that it was affecting people who were younger. And when those folks had passed, they found that it was actually, in some of these postmortems, that it was these very soggy lungs that helped to cause, and not only it caused the death, but it caused some of the earlier cases to be misdiagnosed as pneumonia. They tried their best to create spaces that, again, look very similar to some of the images that we will see on the front pages of newspapers today. You have more people getting ill than they were prepared for amidst this global catastrophic war that's already decimated so much of the physical geography, really, of Europe. And so many people do rise to this occasion. And it's not just those within the military, it is community members as well. You can see right here that the 39th Regiment was heading out on its way to France, but those in the Seattle chapter of the Red Cross had sewed each one of them a mask, because already they knew that that was an important part of trying to not spread the disease. In the influenza epidemic, you can see right here, the Red Cross that had been prepared, that had actually been serving overseas, serving on both sides in 1915, 1916, they were aiding and providing medical assistance to both the Allied and the Central Powers. Once the United States joined the war, they actually called back particularly many of the female leaders who had headed the organization, and they militarized the Red Cross overseas. However, those individuals who had such essential experiences in organization and in providing massive assistance on nationwide level were very quickly needed inside the United States. And Rob, I'm going to kind of bounce it back to you. One of the things that they were trying to do is they did think that they might have some preventative treatments against influenza, like you see here where they're spraying somebody's throat, which did not necessarily seem to be all that effective. But I am not a science teacher, I am a history teacher. Rob, can you give us a little bit more information on the science behind the 1918 flu pandemic?
This is a graph showing all the flu seasons, because flu was not an unknown disease. They weren't sure what was causing it, but it had a character specific enough for them to be able to identify it. So all winters, you can see there in 1891, there was a bad flu season, okay? So 300 people per 100,000 died of it that year. And then you see all the way up, and you see the giant peaks in 1918 and 1919. So notice that that graph at the bottom, it's got a higher scale, right? It goes all the way up to 800. And you can see that 1918 and 1919 were just huge peaks, just much more enormous than had ever been experienced before. So this pandemic, an epidemic is when a disease gets really bad in one place. A pandemic is when a disease gets really bad across the whole world. And this pandemic was worse than anything we've experienced ever in human knowledge. So all the way going back to the Black Plague, it was probably as bad as that. Here's another graph showing all across the country afterwards.
Sorry, it's certainly the worst in the 20th century. It's roughly 1 in 10 was the mortality rate for the majority who were becoming ill, at least in the spaces that we have the numbers for. Because particularly in Asia and Africa, it is difficult to have, to get the proper statistics in those spaces. Another thing, and I want to add to what Rob was saying.
And it's hard to compare mortality. Yeah.
Oh, another thing that I want to add to what Rob was saying about death tolls, we also have to take into account that during World War I, segregation was a practice across the nation. Woodrow Wilson, when he came back into power, actually reinstituted segregation. It had been desegregated in the federal government. He did reinstate that. And so you do also have a different level of care that is occurring for different communities within the United States. And because segregation was enforced, and that was enforced at many hospitals, it barred access to non-white patients. Even hospitals that did offer facilities for individuals weren't necessarily the equal spaces. So the cost was even more severe for some communities within the United States.
Yeah, and there was that black-white segregation line, but there was also This was a time at the end of a period of huge immigration. So cities like Philadelphia and Boston had a huge percentage of their communities that were immigrants from Eastern Europe, and that didn't speak the language. So, and were living very densely. So you could see on this graph, it just compares for the rest of the century up to the 1950s, how bad the flus were. Now, I will say, I'm gonna like get out of order and say that the first flu vaccine was in 1944. And look, after that, how many huge flu outbreaks have there been? Vaccines are very important. Okay, so this shows another thing that happens. So you'll see these curves. This is the number of people at the bottom, how old they are. Wow, I just lost half my body there. How half the people at the bottom, it shows the age of people, and going up, it shows the death rate. So you can see that the 1918, 1919, and 1920 flu had many more young people dying of the flu than had happened in the past. Usually the flu was something that was a threat to babies and older people. And that was not true of this flu. For some reason, it attacked the immune system in some way that younger people were more affected by it. This is one of the first images of this virus. So I said, you know, at that time, they knew about bacteria, and they knew that there were some diseases that they could filter the bacteria out, and the juice left over would still cause a disease. So when this started, people were pretty convinced that the flu was caused by a bacterium that was identified first by a guy named Pfeiffer. So they called it Pfeiffer's bacillus. And during this epidemic, it became doubtful that that was the cause, because people would do autopsies and they would find some people that died of the flu that didn't have this bacteria, or they had several other bacteria instead. Okay, so now we're getting into the time after this. So in the 1930s, it's really interesting. An interesting thing we could talk a lot about, but we won't today, is, you know, people very soon forgot about how bad this epidemic was, perhaps because it was wrapped up in the war. Perhaps it just affected everybody so much that it's hard to say what effect it had, you know? So, but in the 1930s, some epidemiologists got very interested in how this had happened, and were worried about it happening again. So they went back and they tried to study it. And one of them was a guy at Johns Hopkins who had grown up in Iowa on pig farms. And he remembered that as a child, there had been a lot of flu in the pigs at that time. And so he went back and he tested people and the pigs and found that they had very similar antibodies for the flu. And so he hypothesized that maybe it was the flu had come from the pigs into the human population there in the Midwest and got to Camp Funston. But he didn't stop there. He did some experiments that showed definitely that it was what they called back then a virus. They didn't know what a virus was. They just knew that it was smaller than a bacteria. They didn't know if it was a molecule or a chemical or an organism. So it turns out that it's not any of those. A virus is kind of an organism, but not really an organism, because it can't survive on its own. It can only survive inside of a cell. And so in the 1930s at Vanderbilt, they discovered that they could grow more. So like bacteria, you just put them in a dish and you grow more, or in a medium and you grow more of them. You can't do that with a virus. You put it in a petri dish and nothing's going to happen. It has to grow inside of cells. So they discovered that they could put the flu virus inside of a fertilized egg and it would grow inside that embryonic chick, and they could get lots more bacteria, viruses. And so they eventually wanted to get to a vaccine, and that's what we're talking about today, a vaccine for coronavirus. But it took them, they started this research in like 1930. The vaccine was available in 1944. took them a long time. We have tools and technologies they didn't have then. And we have government organizations that are in charge of funding this research, but back then they didn't have that either. But the scientists worked and worked. They first had to identify the vaccine in 1936 and 37. They started the first tests. But they discovered that there isn't just one kind of influenza virus. There are several kinds of influenza viruses, and we'll always get flu shots if you can. A flu shot has dead viruses in it from different kinds of strains, and they pick those strains based on their research from the previous year about what viruses are around in the environment. And so these are kids in 1948 in New York City getting their little flu vaccine, and if they could get a flu vaccine, you certainly could get a flu vaccine. It will help you a lot.
I agree with you, as does a mutual friend of both of our museums, Michael Nyberg. Generally, when he's asked the question, what's the one thing you should learn from World War I, or what's the takeaway that you can that you should have from World War I? Generally, his answer, at least in recent years, has been go get your flu shot, which is a pretty clear, a pretty good and clear and actionable answer. That is one of the questions to learn from history. And you guys have some really great questions along the way here. So I'm going to try to address many of these as we go along. And also address some of the really great points that Rob pointed out and made in his conversation. It was this time that people tended to not, and it is one of the differences between World War I and World War II, they don't share as much about some of their experiences. And there's a bit of study about the reasons why. Some historians have said it's the part of that trauma of the of loss that was felt then both on the home front and over there, both being on the battlefield and being back at home where so many do lose their lives. You can see inside the United States, it's actually 675,000 Americans who die over the course of a year and a half. And then one of the letters that we have in our archive is actually a gentleman who is preparing to serve, and he's writing back home to Nashua, which has been hit with the flu pandemic, and his outpouring of concern for his hometown. There is also this kind of sense and this push to return to normalcy. Now that's actually a phrase associated with a different president, not Woodrow Wilson, but I think it's something that we can all identify with today, of that desire to return to normal. And one of the things that I find to be so optimistic about all of the conversation that's happening right now is that there's this conversation about returning to normal, but making it a different normal, making it better as we look ahead. And that's part of the questions that some of you all have asked. One from Facebook: what are some of the lessons from 1918 that can help us understand the pandemic today? One that Rob mentioned: make sure that your mask is not something that you can see candlelight through. If you are, if it's got a lot of holes like gauze, that is going to actually help spread the disease, not prevent its spread. Another is to use those masks correctly. Also, they did learn about social distancing. That graph that many of you have seen in media today is reportedly actually the numbers of the city of St. Louis versus the city in Pennsylvania that Rob mentioned earlier that did have their Liberty Loan Parade. And just the difference in shutting things down early versus waiting a week or two. That really is a lesson that back in February and March of this year, I think many of our political officials, depending upon where you're listening from, may have actually been referencing that very specific history as they started making some of their choices. And you'll see, I mean, in Kansas City, it was actually that they, by like October 7th of 1918, all schools, all churches, all theaters were closed, and groupings of 20 people or more were banned. So there's this echo of things that we actually are implementing out of that knowledge from before. That was certainly the largest of the pandemics. There have been a couple of others that really didn't hit the United States as much as people were expecting. And part of that is we've been learning from history and making some really good choices as we've also been innovating. Innovating as they did on the battlefields and on the front line, recognizing that need for better blood transfusion. That's a pretty significant medical innovation that comes out of World War I. A couple of the other questions that you guys have asked, and some really, really nice ones here. Was the Spanish flu, and I like to call it the influenza pandemic 1918-1919, like to support my Spanish journalists here. Was it caused by the H1N1 virus? Yes, it absolutely was. And you can probably follow up with Rob to find out some more of the other particular viruses and what that looks like. There's some really great articles as well in our education newsletter. If you go to www.theworldwar.org, we actually partner with the United States World War I Centennial Commission to send out a monthly newsletter to educators and highlighting not only our resources, but the resources of our outstanding partners. And the last issue is all about the flu and the influenza pandemic of 1918 and today. We've got some science lessons from the CDC. We've got some economic lessons from the World Economic Forum. So you can find out some more of that information in there. Did this pandemic result in as much economic hardship and business closings as today? Jenkins, great question. It's really difficult for us to know because it's layered on top of this catastrophic global war. And so to be able to specifically pinpoint which is what, back in that time frame, would take someone who is more fine-tuned in this than I am. But I would highly suggest taking a look at two particular books, actually three. There's a great book by Carol Byerly, and she tracks disease in the military, and she goes into World War I, but also up through World War II as well. Really great, interesting book. That kind of delves into that. Nancy Bristow has written beautifully on this as well, as has Kenneth Davis. Now, Kenneth Davis, if you are a student watching this right now, totally, that is the one you want to pick up. It is awesome. It's super relatable and gives you a lot more of a deep dive in a very interesting and consumable manner. I'm going to try to keep up with some of these really great questions. Why did the US, Britain, and France not report it? The US actually was a little bit more open. I haven't been able to find too many spaces where the United States was censoring their own journalists. It really was more out of nations that had already been in deeply entrenched in the war, and I absolutely mean that pun, who had already been in that practice. There's more evidence is showing that it was within Europe that information was being tamped down. Kansas City is the home of the National World War I Museum and Memorial. It was built in 1926. There's a new national memorial that is also additionally being built in Washington, D.C. It's going to be located at Pershing Park. You can find out more information about that at worldwar1cc.org. But since kind of the 1980s, when the Vietnam Wall was added, we have been adding more war memorials to into Washington, D.C. And so there's been a big effort to make sure that those individuals who lived through and who died during World War I are also remembered in Washington, D.C. Richard Thompson, did they bury troops at sea? Great question. And if you go to our research center, you can get a lot more information about that. Xenon Man, you asked the question, why was there not an outcry against naming the pandemic the Spanish flu? And honestly, it's in part because the Spanish genuinely thought it began in Madrid. They actually thought that they might be the epicenter because nobody else was talking about it. And so individuals really did think it had started there. Now, there might be folks around the world who had inklings. Some of these epidemiologists that Rob was talking about, they might have known that there had been these other cases. But when this all popped up, even the Spanish thought that it might have begun right there. And I think part of this outcry, as you mentioned here, about using the term Wuhan flu or Chinese flu, is maybe a reflection of some of what we now know about history. And our thoughts about identifying a whole geographic region with some of these things. Rachel Collins asked, how many soldiers were killed on the front lines? Millions. Of the 50 million, you are going to have millions who are in service, who die. Really great question, and it really is because of that global fighting and that global movement of peoples that you have such tragic numbers, because there's such transmission of a highly transmissible disease and an environment that's already horrific. You know, you've got all these farm fields and battlefields, all these farm fields that are now battlefields. So there are places that are really experiencing famine as well, right? And you have the things that are going on in the Middle East and the like. I'm going to look to see, Rob, are there other questions? Are there other questions?
Why don't you find one last question and then we'll wrap up.
Great. Oh my goodness. And honestly, Rob, this question might be I'm going to ask. It's two versions of a question to you, and see if you've got an answer for either one of these.
Yep.
So the first is that since there wasn't a vaccine in 1918,
Yep.
1919, is it just that the flu went away? And in the archive of the National World War II Museum, are there any letters or collections or anything that talks about people's experience mid-century with the pandemic?
I don't think we have letters that really are about that. I think you are more likely to have letters about it because people didn't really remember or talk about it that much afterwards. It did have its influence in literature, but you know, so the answer to that is no. But did it just go away? Flus never really go away. They evolve and change, and one strain gets less and another strain gets more. That flu just infected so many people that
Herd
that
immunity.
eventually they become immune. Yeah, they become immune. So I gave Chrissy a link to a little simulation you could do online where you show, like, eventually in the simulation everybody gets the disease, but you could show if you socially isolate how long it takes for everybody to get it. But yeah, but herd immunity when there's a lot of mortality is not, people have talked about it as something we want to get to. And you don't want to get to it when you have a disease that causes a lot of deaths, you know, so like you don't want herd immunity to polio or something like that. You want herd immunity to something that makes you feel sick but not deadly. They did technically use what they called a vaccine back then, but it was a vaccine for that Pfeiffer's bacillus, and it wasn't very effective. So we're going to wrap up. And thank you for all your exciting questions and for all your information, Laura. I'm sorry about all the difficulties we had today on my end and your end, but let's invite everybody back tomorrow. We're going to talk about how we ended up getting from the war to end all wars to another war with pretty much the same combatants on either side. And that'll be very exciting. If you have other questions, you know, I manage our Facebook teacher group, so send them to me or email me. And later in the summer, I'll have modified questions that you can do in your summer camp at home. I'll have activities you could do to learn more about viruses and epidemics. So thank you, everybody. It's been great to see you, Laura, and I'll see you again tomorrow. And I hope everybody joins us.
It would be great. If you've got any
All right.
questions for us, email us at education@theworldwar.org. Thanks so much for joining us. See you tomorrow.
Okay. Bye.